Hello, everyone, and thank you for showing up. My name is Fitsum. I'm here as your facilitator. We're all excited for such a great inspirational speakers lined up. And as we all know, today's discussion is about designing regenerative systems. How can systems thinking drive culturally tailored food, health, and social enterprises to achieve the sustainable development goals? So the reason why we chose this huge or very broad kind of title or topic is because we believe in ourselves. We can do a lot if individually since individually we can't do much, but together we can do a lot. That's the whole idea behind it. So just to set the stage, the whole thing, as you have seen it, the first part of the discussion will focus on agroecology and food systems. Dr. Yodit from FAO, or Food and Agriculture Organization headquarters, will go for it. And then after that, we will have a health-related discussion or inspiration by Dr. Dessie. And after that, we will have very good inspiration about the food is medicine that's going on probably within the US. It's something that is really, something it's seen as a distinct in the United States. In particular, the growing food is medicine movement is gaining, tractions in a way to address the links between food systems and public health. And we believe there is an opportunity to both learn from the country and contribute to these movements through a global lens. Of course, we all know that we're just proposing this initiative to promote food is medicine thinking and programming specifically for Africa diaspora at the moment. And this effort would center on healthy traditional foods and cultural practices while also raising awareness about food-related traditions that may have adverse health impacts. But of course, some point we started here since we are only here. That's the only reason. But other than that, of course, we would like to, every one of us, take it over and then expand it throughout the world in every possible manner. So having said that, I would like to give the floor to Dr. Yodit. Please introduce yourself and let's hop on to your presentation.
Hello, everyone. I'm Yodit Kebede. I am an agroecologist by training. I studied in Wageningen in landscape ecology with on pest issues, actually ecological pest control. That was my entry point, which actually led me to more holistic and systemic research, taking into account also social aspects and economic aspects. My field work was in Ethiopia. I've been working as a researcher for several years for French organizations, but also in Belgium. But all the most of my work, field work, actually was in Africa. I worked for FAO also in 2017 first, where I've been involved in the development of a tool called TEP, a tool for agroecology performance evaluation. And I'm actually coming back now in FAO. I'm here since about 2-3 weeks to work again on this tool, which is being updated and improved after being tested for several years by numerous partners who gave us some feedback to improve it. So today, my talk is about agroecology in general, and it's linked to health. As I don't know, like how much the participants are aware about this concept. I'm really giving like an overall introduction on it, and also linking it with a health aspect, so that we can open up for discussion after the presentation, and for really more specific questions in relation to your project. So what is agroecology? Agroecology is defined as a science, as a practice, and also as a social movement. This is an important aspect also of agroecology. It goes from field level to food system approach, so the whole chain of the food production. Uh, there are principles which are guiding practices at soil level, at plot level, at landscape level, but also some principles which are more linked to social aspects about also on governance, on knowledge sharing, etc. So it is really value led and value based approach to agriculture. Around agroecology, we also hear a number of other concepts. We hear about regenerative agriculture. This is something which concept which is more used in the US because many organizations in the US and especially the corporate organization do not like the social movement aspect of agroecology and the whole social component of agroecology. You also have organic agriculture, which is much more, which actually encompasses less social aspects, which focus more on the ecological and environment aspects of the production system. You hear also about climate smart agriculture, which the objective is promoting climate adaptation and mitigation, but which is actually also too much focus only on that aspect and which has not like a system approach. So agroecology is actually contributing to climate adaptation and mitigation. It's actually also promoting a healthy and production of healthy diets and food production, but at the same time taking into consideration the participation of all communities and all actors along the value chain, and at the same time also distributing the power in the value chain between different actors and not let the power of food production only in the hands of few organizations. So there have been two concepts, frameworks, which have been developed in parallel for actually defining agroecology. So agroecology is not just a set of practice, it's not just a formula, it's more about principles like defined by the HLP, the high-level panel of experts in 2019. They defined 13 principles of what actually agroecology encompasses. And at FAO, we developed actually the 10 elements. And they both, both the 10 elements and 13 principles have many aspects, actually many principles in common. For example, the co-creation of knowledge. This is really at the heart of agroecology. And the only thing is the way the 10 elements have been developed, it has been a consensus between civil society organization, FAO decision makers, and researchers. And there was some agreement to find on some terms, etc. So we had to maybe be less specific on aspects related to pesticide and fertilizer. And in general, in chemical input is a subject which is very which actually can lead to misconception or misunderstanding between different actors. So at FAO, they have been a bit more vague on those aspects, even though the objective is to reduce the utilization of those inputs. I will not go too much into the details of those principles and elements. I can come back later on during the discussion. I think you had also the chance to look at it. As I say, co-creation of knowledge is at the heart of the two concepts, the two frameworks. And then you have elements related more on the ecological aspect, like the soil health, animal health, biodiversity, and resilience, etc. and concepts related to social aspects, the responsible governance, the human and social values, which also encompasses the healthy diets and culturally relevant food. So what are the benefits of agroecology? Actually, agroecology promotes diverse and resilient agricultural practices, and the objective is to increase the production when it's necessary to increase it. It's also about supporting local food systems and making nutritious food accessible to all communities. It's about also enhancing the stability of food systems by mitigating impact of climate change and the environment disruption in general. And also it's about improving the nutritional quality of food through diverse crop cultivation and organic and agroecological farming. Several studies have been already looking at the link between agroecology and the SDGs, and this is something which it is quite documented and is available in several publications. So agroecology contribute positively to climate mitigation, to life on land, to clean water and sanitation, to responsible consumption and production, to good health and well-being, and to zero hunger, while also reducing negative impacts on those same SDGs. So I will invite you to look further on that, because it seems that in your project that you wish to develop, you are also trying to make more this link more visible. And this links, we are also using it here right now at FAO in the revision of the TEP tool, the tool for agroecology performance evaluation, because some of the indicators and the criteria within TEP are also contributing to the SDGs. So, or either we take info those criteria from the SDGs directly, or TEP contribute to monitoring also the SDGs. This is also an objective for us to make this link. Agroecology is relevant both for the global north and for the global south, and the problematics and the starting points of both systems are different. Within the global south, where we still have a majority of subsistence farming, the objective will be to diversify the production, to mechanize the system, to build also the knowledge, and to connect farmers to market. Within industrial global north production system, we know that we need to reduce the use of chemical inputs, to relocalize the production, which are now very much scattered and which use a lot of fossil fuel, which actually contribute also to increase climate variability. And we also need in the global north to increase the knowledge, the capacity on those diversified farming system approaches. To go further on this, but also to see even more the link with between agroecology and health, I will invite you to look at the second magazine. It was actually it has been published about a month ago by Rooted, which is specifically about agroecology and health. And also, at a certain point, maybe of development of the project, might be also interesting to look at TEP as a way of monitoring and evaluating the progress of your project. And you will also find a number of indicators and criteria that can be interesting to integrate in development of your proposal. Thank you for your attention.
Thank you. Thank you so much. That was very insightful, and thank you for setting the stone and everything, Yodit. This is very important linkage since we're speaking about system thinking. So, having said that, I would like to give the floor to the next speaker, to Dr. Dessie. Please introduce yourself and go ahead, please. Thank you.
Yeah, thank you very much, Filsum. My name is Dessie MEKONNEN. I am the public health practitioner, long time worked at WHO, and the most recent experience was working with USAID funded, but currently I'm working for WHO for consultant. So this is my brief overview of experience. So mostly in the public health area, maternal and child health, programs and the vaccine preventable diseases, immunization and preventive of disease and promotion of health. So let me just share my slide presentation and quickly to share my presentation today. Can you see my slide? Please, can you confirm? Okay, thank you very much. So my presentation will be focusing on the older adult nutrition and health. So just to start with some background information in terms of the population, about the older population. So we can see some of the data by 2030, we'll have 1 in 6 people in the world will be aged 60 years and over. So the population will be growing very rapidly, and it will be expected to be about 1.4 billion in 2030. That's the prediction. So most of this older population live in Eastern and Southern East Asia, and 26% in Europe, in America, and then there are also substantial number in Sub-Saharan Africa as well. So women tend to live longer than men, obviously, because of several factors. And also there will be a change in terms of, the aging, biological, and some other changes can happen as obviously. And that, gradually affects the physical and the mental status of the individual. So there are some health conditions that happen when people are growing in terms of age. Some of these are like, some of the organs may not be functioning very well, like ears, eyes, and some pains around the bones, and there will be some diabetic and chronic diseases, and mostly that are related to the nutrition. So these are some of the issues, and complexity is depending on the status of the individual and the nutritional status as well. So just what healthy aging in developing and maintaining the functional ability that enables the well-being in older people. So you can see a lot of wording here. This is about, the nutrition and how aging well and mentally, socially, psychological, and also nutritionally. So health is defined very well in terms of having all those comprehensive elements of health. So there are 5 pillars facilitating the age well. So the first one is nutrition, obviously, and there is always related to nutrition, which is hydration, having a healthy diet, physical exercise, and also social and cognitive. These are the basic elements to be like aging well in terms of the health aspect. So let's come to the nutrition and the diet around that area. So the healthy diet means it's helping protecting against malnutrition, particularly in terms of preventing the non-communicable diseases, including diabetes mellitus, heart disease, stroke, cancer, which are very common in older adults as well. So basically, our nutrition must be maintained and balanced very well from the different elements of the food. So, for example, the total fat should not be exceed 30% of the total energy. This is the WHO recommendation that we maintain our food. So basically, for older, it has to be very strict, maintaining those kind of WHO recommendation, energy expenditure, and also energy intake. So the intake of saturated fats also should be maintained, particularly below 10% as per the WHO recommendation. So this is mainly related to the cholesterol and some other effects in our body. So healthy diets usually includes more vegetables, fruits, healthy protein, and whole grains, and of course, having some healthy oils and a lot of hydration using water. So in order to address those issues, WHO, through the United Nations, there was a plan of action that was developed that aligned with the Sustainable Development Goals. So it will be achieved by 2030. There are 4 key components in order to achieve those Sustainable Development Goals. One is age-friendly environment, as already mentioned, the first presenter, which is related to the environment. And combating ageism and integrated care is needed for the older age groups. and also long-term care, including healthy diet, through different innovative mechanisms to address those issues. So one of the innovations that recently started in the US, and there are also some good promising results and outcomes in terms of the positive health outcomes. For example, one study indicating that the bad cholesterol level was decreasing after having a 1 year provision of the food as a medicine and food by prescription. So that's linked to the risk of cardiovascular disease or stroke or some kind of, a cardiac arrest. So these levels significantly decreased because of having consistently taking food as a prescription, which is a promising result. So the other one is related to the diabetes mellitus. There is a hemoglobin, one of the blood element level. The level is A1C. That level is also helping to monitor the diabetes or pre-diabetic kind of level for individuals. So this level also significantly dropped after having a 1 year practicing or provision of food by prescription. So there are promising, and still is a new area. I think this is the area that we can do more research and having more evidences, particularly when it comes to the African community. The culture is a bit different, so that has to be also designed in a very well and innovative in order to have those kind of results. Yeah. So this is my brief presentation, and thank you very much. And this is the healthy food and enjoy with the healthy food styles. Yeah, thanks. Over to you, Filson.
Thank you, Dr. Dessie. It's such a great presentation. What I like about this is because it just took me to the memory where I've been actually working on a food by prescription program back home in Ethiopia, which was funded by the then USAID. And I remember it was really a huge thing in Africa because it was also implemented in Tanzania and in other parts of Africa. And I've seen that was one of the most actually motivational and inspirational thing, because I had a chance to see what's really it looks like at the grassroots level, etc. And yeah, I can't relate more with what you're saying. Thank you so much, Dessie. Having said that, I would like to pass the third speaker, which is Meklit. Meklit, over to you. Please introduce yourself first.
Great, thank you. Just give me a second. I'm going to pull up to share my screen real quick.
Sure.
Okay, please let me know if you can see my presentation.
Yes, we can see it.
Okay, awesome. Great. So hello, good morning, good afternoon, everybody. I'm Meklit Hailemeskal. I am a public health specialist. I have worked sort of both in the private consulting sector as well as nonprofit sector. Most recently, I was with Deloitte Consulting, and I was consulting primarily for CDC on some of their domestic chronic disease prevention and management efforts, and also spent some time consulting with USAID on some of their health system strengthening work across different countries in Africa and Asia. So I'm kind of coming to this from my interest in food as medicine sort of stemmed from the work I was doing on the US side in terms of, chronic disease prevention and management efforts. But as I'm sort of thinking, like my own interests and my own career interests, looking forward in my own career, I'm really wanting to focus on taking what I've learned from what's happening in the U.S. sector and applying it to what can be or what we can learn and take and use in the African context, and vice versa as well, right? I think there's lots that we can take from the African context and come and apply in the US, especially as it relates to food and the cultures and thinking around food. As you see from my screen here, food is more than just sustenance, right? Food can be medicine, food is culture, food is community, especially in our cultures. There's a lot that goes around food and food cultures beyond just what we consume, right? It's how we consume it, with whom we consume it. And so all of that, I think, is important to think about and consider as we think about food and food systems. So I think Dr. Dessie and Dr. Yodit have set a really great context for my presentation. They've covered the food system part as well as the health piece, but just to kind of reiterate a few points here. I think when we talk about food, especially within the developing context, a lot of the conversation, I think, focuses on undernutrition and malnutrition, specifically within the under 5 population, and also within sort of the maternal health sector, right? And that's very correct, rightly received a lot of attention, a lot of interventions. I think now we're increasingly seeing food-related issues among the adult population, right? So right now, a lot of developing countries face sort of what's called the triple burden of food-related challenges, right? There is ongoing persistent undernutrition concerns in children under 5, and also pregnant women, as malnutrition in pregnant women translates to undernutrition, as well as other chronic issues in children. There's also micronutrient deficiency. So people are getting the caloric intake that they need, but they are missing the micronutrients like vitamin deficiencies, mineral deficiencies, because the foods that they eat are not diverse. They might focus on like starchy foods only, and they're not getting the leafy greens or fruits and vegetables that provide the vitamins and the minerals that are needed. And then now, increasingly, as Dr. Dessie mentioned, we're seeing more overnutrition, right? People are consuming more calories than they need, with lifestyles that are not supporting the caloric expenditure, right? So then it is leading to those chronic conditions that we're seeing more and more in communities across Africa. So as Dr. Dessie mentioned, increase in diabetes, increase in cardiovascular related diseases, and then also we're seeing increases in cancer, mental health, which do indirectly also or can indirectly be tied to diet. At the same time, right, we are seeing big changes in the, I guess, agro industry, or just sort of the agricultural and economic landscape. So we're seeing less and less cultivation of indigenous grains and vegetables in favor of cash crops. We're seeing like non-traditional vegetables, right? But vegetables and legumes and nuts and things that are not traditionally consumed in the diets, that are being grown but used for export and not consumed. Which is a huge misadvantage, because I think, especially I'll speak from Ethiopian context, there's lots of things that we grow that we don't need that are high in nutritional value, such as nuts and certain types of legumes. They're just not integrated into our traditional diets, and therefore I think there's just a huge lack of opportunity there. And at the same time, there's an increase in imported grains, and a lot of times imported grains are genetically modified and not as nutritionally whole as they could be, or as their local counterparts. And then as countries open up their markets and they're becoming more and more developed, we're seeing more and more processed foods and sugary drinks on grocery shelves, both mostly in urban areas, but now more and more in rural areas as well as more ready-to-eat options. As lifestyles are changing, people are getting busier, they're not cooking as much at home, and opting to purchase ready-made foods. And we know from the U.S. context that all of these lead to poor diets and poor nutritions. And so we're just sort of like starting to get, we're on the earlier cusp, I think, in a lot of African countries, but it's not a good trend right now. So I think there are some good interventions that are already being implemented in different countries. And I apologize, I'm focusing here on Africa, but I think there's a lot happening across the world. But I'm just kind of focusing on Africa. That's what I'm more aware of. So my examples are a little bit more biased here, but there are, we are starting to see more effort and more targeted kind of advocacy and programming around addressing some of these. So some promising interventions, there's increased regulation on processed foods. There's, there are some countries that have implemented taxes on sugary drinks and ultra processed foods, which again, it's early stages, right? But I think they are starting to see some of the results on diabetes rates, et cetera, as a result of putting in those taxations. There's front of package labeling, similar to what we have, I think, in Europe and the US, that sort of shows what is healthy, what unhealthy ingredients may be in the food, and then I think the other pieces here are things that are starting but haven't really gained a whole lot of traction yet. But I think there's definitely lots of opportunity for incentives for cultivating and incentivizing intra-Africa trade of indigenous crops, right? Because there's lots of really healthy, wholesome crops and food items that are used in West Africa that are not necessarily grown or known about in East Africa, right? Or even if we have the potential to grow it, we don't know how to consume it. And so I think there's a lot of opportunity to exchange not just the actual crops and the actual foods, but also the knowledge of how to integrate those things into our diets. And then and also just instituting restricted marketing on healthy foods. Sorry, my screen is okay. And then there's growing number of countries that are putting in place like national level school feeding programs and school gardens, especially in urban areas, because urban children tend to have less access to fresh fruits and vegetables. And then this last one is putting in place local, culturally specific dietary guidelines, right? I think we have the WHO guidelines that Dr. Dessie shared, but then taking that and customizing it and tailoring it for local context. And this picture here, it's not very clear, but this is an example from Ethiopia, which has taken the initiative of creating a national dietary guideline based on locally consumed grains, legumes, etc. This is just a quick, I know we've been sort of saying food is medicine, so I just wanted to provide a brief overview of what that means within the US context. I think it is a really interesting concept, but it is very specific to the US context because it relies on the US health care and health insurance system, right? So essentially in the US, there are lots of food deserts. There are lots of communities that are not able to afford food or don't have access to healthy, fresh fruits and vegetables. And so this is an effort to really provide ease of access to healthy foods and vegetables specifically for those communities. And you can kind of see it goes up the chain, right? So at the bottom of the pyramid, this is sort of more population level interventions and policies that promote healthy food, education programs, etc. And then as you get up, it kind of narrows down in scope and also in focus of population, right? So as you go higher up in the pyramid, it starts to focus on people that have some sort of health condition or have been diagnosed with like some sort of chronic disease, and they receive an actual prescription from their healthcare provider to, go get, a pound of broccoli or a pound of legumes or whatever, and they are covered by insurance to actually purchase whatever is prescribed, whatever food is prescribed to them. And in addition, they work with a nutritionist or a dietitian, a registered dietitian, to support them on this journey, right? So it's very, very specific, individualized prescription of foods, and accompanied by nutrition support or nutrition education. And then medically tailored means all the way at the top again, is very specific to those that are really critically ill, and they are receiving very carefully tailored meals that are, designed to fit their whatever condition, the health condition they have, and designed by a nutritionist. And again, all of this is covered by health insurance. So I think the concept is really great. I think it works for the US context. And again, it's still new concept for the US. It's being picked up. Not all insurances cover this. Not all states are implementing this, but it is gaining traction pretty quickly as a promising practice and as a very cost-effective practice for addressing chronic diseases for people that are chronically ill, as well as people that are not able to afford or have access to healthy foods and vegetables. But I think there's, some interesting things to learn and gain from this specific intervention when we then go back to the developing or emerging markets, developing world context, right? What is it that we can learn from this concept and then apply to, countries in Africa and Asia, et cetera? I think one thing that I don't think is as common in those health systems is this idea of individually tailored medicine, right? And so like looking very specifically at one patient and saying, what is your health condition? What are your food cultures, customs, et cetera? And then prescribing a very like precision medicine, right? You're really looking at that one person and tailoring your intervention, in this case, a nutrition kind of intervention to that specific person. I think, we don't have a lot of dietitians or registered nutritionists. I think there's a lot of opportunity, again, as a cost-effective measure, training and licensing for dietitians and nutritionists, I think is a cheaper intervention than training medical doctors, right? And so this could be a cost-effective way of supplementing the medical team and also addressing some of these issues. Increased health education in schools, community level health screenings, and then partnership with private sector, especially the food sector. And I think there are also lots of opportunities for entrepreneurs. We see lots of health apps and nutrition apps that could be really, again, targeted and done in conjunction with the medical teams. I think there's huge opportunity to produce like healthy foods and put them on grocery shelves, right? Not just the sugary drinks, et cetera, but similar to what we see in Europe and the US. There's the healthy foods market is huge right now, and I think that could be said for other countries as well. And then starting to introduce this idea of, for those that are critically ill or chronically ill, really doing these medically tailored meals or interventions that are much more sort of focused and individually tailored to each patient. So those are just some ideas, I think, to try and like pull together both the food system, the health, and really looking at what are the issues, but then what are the opportunities for us moving forward. So I will turn it back to you, Faisal.
Thank you so much, Meklit. That was an awesome presentation and showing us what exactly is going on and what are the futures that we have here in the US, where we are based in currently, which is also very open to be replicated in other parts of the world. So we have heard so many inspirations, very interesting point of views. So now what's left is a couple of things. Before we move on to the resource mobilization or some sort of fundraising or the economic empowerment aspect of the thought, I would like to ask Rocio to put the poll so that we can have a couple of words from you, because we want it to be as engaging. We have to walk the talk. So if you like, feel free to to participate on this one, and then later on we'll go on for a group discussion. So I'll give you I think 1 minute to each, which is all in all 3 minutes, if it's fine with you.
I'm not sure, sorry, Fitson, I'm not sure if this is the one.
No, actually, this is the last one. If you
Oh,
can
sorry.
no
Let me
worries.
just end this one and I'll
Thank you.
launch it again. Sorry.
Thank you.
Sorry.
No, it's okay. Yeah, this is actually the one. Thank you so much. So we have this part of the one that you see. So okay, you can give it 3 to 4 minutes. I understand it might take longer. Mm.
I see the questions myself, but I can't actually really quick on my answers.
Sorry, can you say it again? I didn't hear that.
I say,
Maybe because you are a co-host, I could.
Yeah, you're a host.
okay, that's why.
I could remove your co-host.
Hmm.
Now you could. You should be able to do it. Let me just remove.
Me too, Rosho. Kindly remove me.
Yes.
And it is now gone then. The poll.
Can you see it or no?
No.
You cannot access the poll?
It was there, but then now it's gone.
Because yes. Check with this link. I just generated a QR code.
Okay.
The other option we have is if it's taking long, we can also proceed to the last 2 presentations, and at the end, we can merge our discussions in one. Because I want to honor all of your time, because I understand most of us will have another engagement right after 15 minutes. Actually, we have like 12 minutes left.
The link is working if you use the
The link access
yeah.
with the QR code to the question. We have by now 17 or 25 participants.
All right. In that case, what I would suggest is for those of us who are already working on it, let's continue. But in the meantime, I would love to invite Todd, the fundraiser guru, whom I know as the president of Rotary Club Alexandria, and also beyond that, we are partners. So please go ahead, introduce yourself, and make your presentations.
I always bristle at the idea of being called an expert, so that's always a problem for me. So I have some experience in areas that other people don't have. That's what I have.
I like the way you're so humble. I understand, yeah, but after giving it for 38 years of service in this area, I think that's who you are. Go ahead, please.
Oh,
yeah.
All right. Very good. Well, I'm happy to thank you for the very kind comments. Here, I'm going to get my slideshow running here. Sorry about that. We'll share it. All right. Everybody sees everything. All right.
Yeah.
All right. Thank you. So I really approach this more from knowledge management, not so much about food, because it really doesn't matter from my perspective as to sort of what we're raising money for. If it goes to a project that's trying to help create something that's going to teach farmers how to, farm a whole grain that they typically don't cultivate in their fields, then we just talk about what's the idea, what's the kernel of it in a sense, and then we find out who else has an interest in that same need. And so it's not a surprise to anyone that we're simply trying to identify those people that also care about the same topic that we care about and invite them to participate in that project. And to essentially, ideally, would be to co-collaborate with them to develop the project from the beginning so that they have input into the process all along the way and feel very vested in that project. And so the presentation goes into how to use knowledge management to do that, but I'm going to be adding a little bit more information to it. All right. Fundraising is never about money. It's the hardest concept for people to get in all of my consulting, is that it's not about, it's that you're a worthy cause, your project is a worthy project, you see all the benefits of it, and so you want to be able to find those, and you're so convinced that it's a worthy project, you are convinced that everyone else should see how worthy of a project that is. And so fundraising is never about money. It's about finding those that see the world the way you see it and want to help create an outcome that you've identified. It's about alignment. Are we aligned on, and several people have talked about the values, you know, it all starts with the values. Are we aligned in the values? Because we're going to have a dispute later on if we're not aligned on values now. Having an investor be part of the co-development is great, but you've got to have really strong, bright lines of boundaries as to what you'll entertain from that investor and what advice you're not going to entertain from that investor. And I say that because high net worth individuals or large foundations, they want to come in, and in many cases, a program manager may want to kind of control, you know, that investment that they're making in your project, and so they want to control aspects of your project. And we would never allow that to happen. Certainly, we want their input, we want their ideas, we want their help. That part's great and wonderful, but we would draw a bright line if someone is stepping over that boundary and wanting to sort of direct our project or direct an aspect. And I'll give you one quick story. So we're working on a large capital campaign to build an equine therapy program for abused children in North Florida here in the United States. It's a $50 million campaign, and it's going to use equine therapy to help these abused children deal with their abuse. And so we're going to have horses on property. We're going to have a horse stable. If you've ever met people who are into horses, they're really into horses. So when you meet a horse person, especially if they have more money than they need and they want to contribute it to the children's home, then they came to us and they said, "Oh yeah, we're definitely in. We want to do the barn, but we want to design the barn and we want to outfit the barn." And we said, "We can't let you do that. We can't let you give us $1 million in order to build the barn or the stable. We already have plans for the stable. We already know what we want the stable to look like. And here's our concern is we've been to their ranch. We've been to see their stable. Their stable has chandeliers, literally chandeliers hanging in the middle of the stable for the horses. And if a donor had come on property at the children's home, gone into the stables to see the horses, and saw chandeliers hanging down the middle of our stable, they would have thought we were bad stewards of their the donations we've received. And so we had to draw a line. That donor did not give us the money. So they had promised us $1 million and they chose not to give us. They still came into the campaign. They just didn't come into the campaign at the same level we had hoped they would. So fundraising is never about money. And there's an old adage that goes, if you ask for money, you'll get advice. If you ask for advice, you'll get money. And that's the co-development aspect of working on a project. I haven't worked in international development, so I don't have a lot of experience to point to. So I don't know what you're experiencing with these program managers at large foundations or individual donors who want to direct your projects. However, I would say that you're encouraged to invite people to come in and co-develop the project with you as early as possible. and not this get into this idea where we show up and we just show, hey, here's what we're working on, see if anything is interesting to you, but we come to you and say what's interesting to you, and potentially we may be working on an initiative in that area. The alignment then is built on what you're working on, who are your donors, the community's needs, as well as your internal capacity. I'm going to be encouraging you to capture as much information about donors, and that's all types of donors, institutional donors like foundations, individual donors, that you really want to know as much about them as possible. And especially the main things you want to know about them is what are they interested in your organization, or what aspect of your organization interests them the most. So what do they like to fund, or what would they like to be involved in funding? And then to use that information to be constantly cultivating the relationship with that individual, with that institution, so that you're always on their radar screen in a positive way, where you're contributing to that donor or that investor's knowledge of your programs and how it impacts the goals that they have set for themselves in their institution or individually. So it takes it takes fundraising away from the transactional, hey, let's go find 1 million people to give us $1 each, we'll have $1 million. By the way, that campaign never works. No one knows 1 million people in order to get them all to give $1. So there's a lot of myths around fundraising, and that's probably one of the greatest myths, is that, well, if we just tell enough people, then they'll see that we're a worthy cause and they'll want to invest. And that's just not true. That is a myth. You must cultivate relationships. You have to go have those deep conversations with institutional or individual investors who are going to be supporting your program, and you have to satisfy their concerns, just as any investment banking concern would want to know all about the entrepreneur before they got involved in investing in that particular business. So it's important to have a lot of information about your donors, mapping their motivations, their values, and their networks, because their networks potentially could turn you on to other investors for your particular projects. And to the extent possible, creating personalized engagement with those donors. So before I go sit down with a major donor to an organization, I'm always going to understand all of their fundraising for the life of their fundraising with that organization. I want to thank the donor in that meeting for the prior gifts that they've made to that particular organization. That's natural. We're all going to do that naturally, but then we want to make sure that we are anticipating what they're working on, what their needs are, and not always from our point of view what our needs are. Had a friend who often said at the beginning of her fundraising seminars was, just because you need money is no reason for someone to give it to you. You have to be a good investment to receive those funds from an institution or individual. That personalized engagement usually comes in the form of some type of a customer relationship management tool that we're capturing data and we're saving it there, and that allows us to segment that data later on in order to send a very specific message to an investor that we know cares about a particular aspect of our program. And so we want to be sure to share that with them, where another donor may not be interested in that same aspect and is interested in something else. And so ideally, you would be wanting to identify what the donor's most interests are and put those into the system, so you can routinely say, hey, everyone that was interested in farm to table programs that were out there trying to get local producers to provide food for local folks, then they would be able to send a message out to all of the donors or investors that believe in that same concept and say, hey, look what we're doing. Look at this social media post. Look at this video we just created that talks about a topic that we know is interesting to you. I'll go quickly here through the rest because I know I'm running over my time. Organizational memory, this is where the CRM system, where you're capturing all the interactions with a donor, but you're also using that to pass information on, because in that investor meeting, you might have learned that there's an aspect of the program that could work better and they have an idea and you agree with that idea, and so you pass it off to the program team. Or you might pass it off to an operations team if they see something else that would make the program run better. Sorry. And so to the extent that you can capture as much of the memory of the organization, where it came from, its founding story, that kind of stuff, those are important points to have. Capture what's working from a fundraising standpoint, and do more of what's working and less of what's not working. I know that sounds crazy, but or simplistic, but it's the advice I give so much to my clients that I feel the need to include it here. And obviously building that institutional knowledge and then sharing it with teams and trying to get everyone in the organization to feed the knowledge base. The learning loop then, as we learn more from the donors, we can take those insights, pass them off to a program team, or adjust messaging in the next campaign. We'll retract the results and debrief the rest of the leadership about that particular investor and what they're interested in, and then circulating that knowledge internally so it doesn't just sit in a database gathering dust, it's actually being utilized. And that makes your fundraising become smarter and not just more frequent and louder. Then finally, just the tools, obviously a donor knowledge base of some sort, a CRM with fields that show what are the areas that that particular investor is interested in, so that it's easy to pull that information when you're ready to send a message or you want to do ongoing communications just to keep them engaged with your organization's projects. And then right now there's a lot of stuff around AI. You can do some great donor segmentation. You can ask the investors what they're most interested in and knowing about your organization, and then analyze that data in order to know that you're giving them what that individual wants from your organization. So start simple, share often, and learn continuously. So how do we raise more money? You should be asking, how do we know that helps? What do we know that helps us raise more money better? And it's not about scripts, it's about systems. And when knowledge flows, generosity grows. And that's what I got.
Thank you so much. Yeah, as I say, many talks, and this is the most one of the most important part. While we're working on the project, of course, it doesn't go without the fuel. So that's very interesting insights, and thank you so much. Now, I understand we are over the time, but still these are very important highlights. And I apologize I could not stop them because everything they say is so important. And whoever is willing to continue, let's just continue this. We have a couple more presentations. The last one is Eric. Eric Sena, please go ahead with your inspirations around economic strengthening and etc.
Okay, thank you, Fichim. And in the interest of time, I'll keep it brief. And so my name is Eric Sena Mote. I worked with the UN Capital Development Fund in Papua New Guinea. I did some work in Fiji, Sierra Leone, Gambia, and my own country, Ghana. So yes, I'll try to keep it brief. I'll speak to it. I'm not going to show any slides. I'll just speak to the whole thing and then we take it from there. Yes. So if we talk about social enterprise, we're talking about businesses that prioritize the environment and also the people within the community rather than thinking of the maximization of profit. So profit is not really the priority when it comes to social enterprises. And if we're talking about regenerative thinking in social enterprise, then of course we're looking at how we can bring all the social enterprises under one platform, because the issues that has to do with or the challenges that social enterprises face mostly has to do with limited access to finance, limited access to markets, limited access to knowledge and information. And then when it comes to issues of policy and regulation, and then digitization of the value chain. So in this presentation, I'm just going to use my own work and what I did extensively in some countries to really demonstrate the regenerative thinking that we're talking about. Yes, so in Fiji, I was part of a project that looked at developing an app for farmers. As you may be aware, when it comes to Fiji is a Pacific Island country, and 83%, about 83% of the rural population are into farming. So the challenge has to do with, even getting data or reliable data on the work that they do. So bringing all these farmers and cooperatives under one platform was something that we wanted to really look at. And we did that using what we call a farmer app, a Pack Farmer app. So with the app, you have all the cooperatives registered on this particular app. And then on the same app, there's so much that can be done that we call it a one-stop shop. So on the app, you go and then you can have information on the weather, on what the government is doing related to agriculture. You can have information or knowledge on the, let me say, the climate smart agriculture and all the modern trends that are happening within the agricultural industry. On the same app, we can access markets. So if you're a farmer and you want to sell your produce, yes, you can just, produce can be put on the app, and then the buyers will also buy from the same app. And then payment is done seamlessly using the mobile money platforms and other channels or digital channels that we created on the platform. The same way, the app also tends to help when it comes to access to finance, because there's ready information in terms of the transactions that are being performed, in terms of what is on sale, in terms of everything. So it helped us to really gather information that helped all these social enterprises to access finance, which is a major challenge that they do encounter. So in the nutshell, what we did was to also digitize the entire agri-value chain, right from the farmer to the aggregator to, let me say, the producer or the manufacturer to the export houses. We're able to just digitize the entire value chain, using this one-stop shop. Yeah, so that was something that we did in Fiji. And then coming to Papua New Guinea, together with the government, as you may be aware, Papua New Guinea, I would say about over 80% of the population are into subsistence agriculture. And again, agri contributes about a quarter of the country's GDP. So there's a lot of focus on agriculture when it comes to PNG. And there as well, what we did was to establish what we call farmer resource centers together with the government. So these centers have been established in almost all the districts within Papua New Guinea. And the farmer resource centers act as a one-stop shop where, for instance, farmers, to solve basically the issues of access to markets, limited access to information and knowledge on modern agricultural trends, or talking of climate smart agriculture, and also in terms of issues around policy and regulation, and also digitization of the entire agri value chain. So these resource centers have a very structured governance, let me say, process in place, or let me say a governance structure in place. And I must say that over 80% of the members are women. And through the farmer resource centers, a women's microbank was also established to really cater for the needs of the farmer resource centers. And the beauty of it is that we're able to also create what we call a biometric system that the women use in banking. For those who are, not so educated, they could just use their fingerprints to really do their deposit withdrawals and all other things. Through the farmer resource centers, a lot of trainings were also conducted with regards to, climate smart agriculture and ensuring that the environment is protected, whilst also achieving the goals of really creating sustainable jobs for these farmers. So these are two interventions from these two different countries that really push or focuses on the environment, whilst also looking at how the livelihood of the people can be improved. And one other thing is that for most of these farmers, they see entrepreneurship to be a means of survival. And so there's no growth mentality or growth outlook. But through these interventions, both from the Pack Farmer app that was done in Fiji and also from the farmer resource centers, then of course there has been a lot of training and education to really change the way they see things and to change their outlook. So now most of them are beginning to see farming as something that is viable and that has a growth potential rather than something that's just for survival. Yes, so in the interest of time, I would want to say that these are a few interventions, and if you want to really understand more or know more, feel free to always reach out. Thank you.
Thank you so much, Eric. I can't thank you all for such a great, very, very inspirational and full of knowledge and energy presentations. Just to say thank you to all 5 speakers for this very incredible wells of speech that you have made. And before we move on to the final breakout sessions to connect the dots, I have a kind of question. Well, it's actually going to be, since we don't have the time, I am going to ask each and every one of you at the end of this meeting, me and Tony and Sarah and the rest of the organizing team will come up with some sort of questionnaire, and then we shall send it to you, because we were hoping to have 2 more polls and 2 discussions, but as you can see, the speeches were very interesting, so we could not stop them, and it's very important. That's why I wanted to just keep it flowing. So having said that, I would like just to give you a heads up that I will follow up with you. In short, but in any case, for some of you, if you're going to stay longer, we will still continue the discussion. And there are also so many important questions in the chat room. So we would like to, give feedbacks and answers to those questions as well. So in short, we are launching a movement, as you can see on the on your screen. I don't know if you see it. Do you see the kind of table, full of text table? If somebody gives me a heads up. Thank you. So we are, as you can see, we're launching a movement. It's just not a project. It's one that bridges health, sustainability, and culture, and we want you to be part of it. So we are forming a task force to co-design and pilot a bold view initiative. Community empowerment through social and behavioral change, food as medicine, agroecology, and entrepreneurship nexus to promote the sustainable development goals. The scope, regarding the scope, since we are currently based in the USA, as we have been saying it at the beginning, we propose starting from where we are to be just a little bit, specific in piloting it, and which is tailored based on social and behavior change approach. But of course, it has to be, expanded based on, everyone's, because SBC or social behavior change is not something that we do all in one, or it's not something that fits all. So we have to contextualize, tailor it to each and every context. So that has to be done for every, ideally for every part of the world. This is actually the initiative and our vision. And by nature, this will differ significantly from similar initiatives in other countries, of course, and our long-term visions, as I said, developing customized strategies for various countries over time. And this project is grounded in real community needs and local knowledge, and it draws from 6 powerful pillars. As you can see on the left side of the column, agroecology for sustainable farming as a healing tool for our environment and communities. And the second one is food is medicine, or food as medicine, reconnecting people with healing power of culturally rooted nutrition. And the third one is Taste of Africa, festivals and marketplaces, which can be combined with entrepreneurship to showcase heritage foods and businesses to shift cultural norms and conceptions, and also supporting the diaspora-owned and local sustainable food businesses to grow and thrive. The fifth one is about knowledge management, capturing and sharing evidence-based insights and lived experiences, whether using AI or the apps that was mentioned earlier, and also involving different institutions, including the Chamber of Commerce, which I already have started linkage with EQ American Chamber of Commerce, and we have also the Africa American Chamber of Commerce, and it goes on every country, everywhere we know we have such kind of possibilities. And this is just the project is kind of it has a SMART goal. By end of 2026, we have set some numbers, and we can do it, but we cannot do it alone. So this is just an invitation as COPs, or community of practitioners, as thinkers, as doers, creatives, activists, funders, entrepreneurs, researchers, public health champions, and culture careers. This is a call to join the task force that will help us co-develop and implement this project. So whether you have expertise in health or agroecology, behavior change, funding, communications, knowledge management, engagement, or simply passionate community member, this is a role for you to play. So yeah, this is your chance to co-shape and scalable, culturally relevant model. And let's now head to our final breakout to reflect on this vision, if that's fine with you. But before that, I would ask Sarah, would you like to make your 24 km4dev perspective, and or shall we just discuss it and then at the end you can do it as a closing? Sarah, if you're here.
Thank you very much, Fitzum, and thank you for the really great session today. I'm very happy to do it at a closing, actually, so let's leave it till then. Thank you very much.
Excellent. Okay, in that case, I can see a little over 20 of us are here, so I'm going to share. Oh, by mistake, I unshared it. I'm going to share it again. The ideal discussion was divided into two breakout sessions. So I'm going to give you the two slides, but we can merge it in one. And for those of us who are already here, let's discuss about it in 5 minutes each. And then for those of us who are not here, we'll follow up with our blog and with the other sort of data collection mechanisms. So yeah, the first part is reflecting on the dots. How can systems thinking and culturally tailored approach transform food and health into tools for equity and well-being in your community? So in your breakout rooms, you start with introduction and choose a rapporteur and give us one of this. And at the end, I also would like to merge the second point, which is this one. That this is about the action. How can we collectively contribute through ideas, resources, networks, or actions to regenerative community-led SDG or Sustainable Development Goals campaign, grounded in the concept not presented earlier? So in your breakout room, you will discuss about, reflect on ways you as an individual, as an organization, as a company, whatever you're representing might support to shape this initiative, and what would meaningful contribution looks like to you, and identify interest to join the task force for the project development. So yeah, all in all, I will give you 5 minutes if it's fine, or 10 minutes. Of course, we'll comment and we'll check in every chat, in every group. So
sorry, Fitzum, you want to do all this in 5 minutes?
5 minutes each, yes. So since this is merged, let's make it 10 minutes if it's fine with everyone. Okay, let's say 10 minutes all in all, please. Orazio, to answer your question.
Hello, welcome back.
Welcome back.
Wow. Okay.
Thank you again. I understand most of you have been squeezed with the time. We can promise you one thing. This is going to continue. It's just the start, and I can see there we can. It's actually proof that everyone is interested on contributing, which is why we are all here. And this listening session is not going to end here. It's going to continue through the follow-up questions that, as I mentioned. Just to give you a heads up from the previous poll, thanks to Lucio, she has left it open and over 35 people responded. And if you can see, the one that you can see in front is the result. And apparently it shows knowledge management and storytelling area is most selected for the first question. And for the second poll, how familiar are you with the system thinking in development work? 47% heard of it, but need more exposure. But we're happy that no one is now familiar about it. So having said that, back to your discussion points. For those of you who are here, I'm going to ask two questions. First, what is the key message or the key contribution that you have got from your discussion in the breakout session? So voluntarily, please hop on and then make your discussions. Just one key discussion point that really strikes you most. Or for the interest of time, let's combine these questions. What the other question is going to be, what is one takeaway from all the presentations, the 5 great presentations that we had so far? So if you can give us 2 things, like key message from the discussion of the breakout session and one of the takeaways from the presentations. The floor is yours now.
So maybe in the interest of time, maybe in terms of key takeaways, it might help maybe if people want to just type it into the chats.
That's excellent.
And then, okay. Everybody can type in their key takeaway, and then maybe just have 1 or 2 people reflect on the breakout.
Okay.
Yeah, what we discussed in the breakout.
That's excellent. Thank you for the point. Yeah, let's just do chat boom. So please text your message in the interest of time. And if there's anyone, at least 1 or 2 person who would like to put on your perspectives, that's good. Otherwise, I will give it to Sarah for the last and most important part of the closing. And here we go. Here is your floor, Sarah. Please go ahead.
Thank you very much, Fitsum, and thank you to all the speakers. I thought looks like we're going to have an amazing project together. So thank you really so much, everybody. I just wanted to note the fact that this is km4dev's 41st Knowledge Cafe, and that 2025 we've been in existence for 25 years, bridging knowledge all over the globe. This year we have loads of activities planned. We have an anniversary event planned, which will be announced soon with Real Care magazine and the km4dev journal. There'll be an issue of the journal. There'll be more events, possibly even a new website. And to those of you who have not been part of the km4dev meetings before, I'm going to ask Gladys, because she's the one who usually does it, to put the link to the community into the chat, please. And back to you, Fitsum, and thanks very much for giving me the opportunity to say a few words.
Thank you. Sorry, Sarah is always humble. She didn't introduce herself. She is actually the leader of Knowledge Management for Development Network. It's a great network, international. She's based in Wageningen University, as far as I remember. Last time we met actually in Vienna, and we know each other from 2016 onwards. And through her leadership, km4dev has really grown and inspired so many community of practitioners. And thank you for that, Sarah. Rocio, I am very, very sincerely grateful because you did actually what they call the fire brigade work. You've been really very instrumental throughout the process by doing the technical perspectives and giving us the insights and the guidance, everything. Without you, I wouldn't have done it anymore. And Gladys, for your promotion, for your support from the beginning, thank you so much. Tony, I'm so grateful for always, taking any opportunity to contribute, to support, and for helping us with coming up with a blog and, the continuation of this project, which is basically sustainability. And last but not least, all amazing participants. Your engagement is what really matters most, and this is what exactly the reason why we are here, and this is what exactly has been witnessed. And this is just the beginning. We will continue listening, and your engagement is actually part of the success if we're speaking about sustainability. So without further ado, I would like to close it, and thank you so much for every one of you, and we'll continue this discussion. Unless if there are any additional questions.
Thank you, Fitsumia. You forgot to acknowledge we have Paul Otsu here, who is our colleague for the Knowledge Cafe and doing great jobs.
There we go, Paul Otsu. Thank you so much.
And the title of Sarah changed. She is the president of km4dev. So
exactly.
And where is Paul? I don't see him on my screen.
I just saw him now. There he is, actually.
Anyway, I'm here. Thank you, guys.
Oh, there you are, Paul. Cool to see you here too. Thank you, Gladys.
Thank you
for mentioning Paul.
Yeah.
So for those,
please go ahead.
Yeah. So for those who are joining for the first time, km4dev, and if you're not yet a member, we've shared how to join our D group and km4dev, and we have a lot of opportunities where you can contribute, be part of the km4dev team, Knowledge Cafe. There is our km4dev channel. There is other activities, km4dev ICT working group. There is also the knowledge sharing toolkit. So you're welcome. We are an amazing community, and feel at home. It is your home. It's a safe space for everyone and safe community.
Absolutely.
Really great, Gladys. Yeah, that's what we like it. That's what we like to hear. Thank you.
All right. Thank you so much. And I apologize for taking longer than expected. Have a good rest of your day, evening, night. Have a good one.
Thank you. Bye-bye.
Thanks, I'll get in touch.